yeah, this is an overview of the family of public health apprenticeships. So some of them, they're all approved for delivery, but they're in various stages of implementation. So as I said, our public health trailblazer group was a group of employers across England, so in local authorities, NHS Trust. I know I can see some of you from our trailblazer group already on here. NHS Trust, voluntary, private sector, as well as professional bodies, Health Education England, PHE as it was. We developed the Community Health and Wellbeing Worker at level 3 and the Public Health Practitioner level 6. So we'll deep dive into those a little bit more, and the level 7 Health and Care Intelligence Specialist, which is closely associated as part of the core public health workforce, and it's also in the same sort of stage of implementation. But if you would like any more information on any of these apprenticeship standards, you can go to our gov.uk page, which is you can find by just typing in apprenticeships that support public health careers. Well, the link is in the back of the pack as well, of the slides, which we will share. And each of these boxes are linked to the standard, so you'll see it comes up with a little hand. So you can go directly to the standard to see all the knowledge, skills and behaviours associated with those. So the Community Health and Wellbeing Worker Apprenticeship is the most recently approved one. It was only approved in December. It's a level 3 apprenticeship, so that's equivalent to A level, and it's 12 months in duration, plus that time for endpoint assessment, which we have 3 months for after every apprenticeship standard. It has a funding associated with it of £7,000, which covers the training elements through, not the salary elements, but that's all done through the apprenticeship levy, which we'll come on to. So this apprenticeship covers quite a wide range of roles, so it's all looking at that emphasis on improving the health of local people and communities, preventing poor health, tackling inequalities. So the broad purpose, as it says here in bold, is to work in partnership with individuals and their communities to identify health and wellbeing needs. So whether that's about housing, mental health, bereavement support, and improve health and prevent ill health through things like sport, creative, cultural, heritage activities. You know, give some examples. So the occupation is found in many different organisations, and it's commissioned by quite a wide range of agencies, so local government, NHS bodies, primary and secondary healthcare, and the voluntary and private sectors. So, and there's a wide range of roles which all have the same core knowledge, skills and behaviours, but maybe in different settings or sectors, or they might have a particular focus or specialise in knowledge. So they may focus mainly on nutrition, but they all fall under that, just as an example, all fall under that occupation of community health and wellbeing worker. So some of you may be quite familiar with roles like social prescriber and link worker, which is one of those personalised care roles that's being embedded into primary care networks. So we are working closely with NHS England and Improvement to embed this apprenticeship in primary care too. We don't have any cohorts running for this yet, as it was only approved in September, but we're hoping to have some of these kicking off from January time. The public health practitioner could be a progression route on from the level 3 community health and wellbeing worker, where it can be an entry point itself. So many of you in public health will be aware of the practitioner role as part of the core public health workforce, but they can be found across the full breadth of public health, and there are many job titles down the right hand side, so they are a lot smaller than before. But they focus on health at a community level or population level to assess and manage the risk of disease and ill health. They're found in councils. I've just got a bad quality network quality pop up, so if I disappear, I'm very sorry. We also have these in government bodies like OHID and UKHSA, the new ones, NHS bodies, voluntary sector as well. So we've built this standard to build on those undergraduate degrees that are already available in public health and to link into the UK Public Health Register practitioner standards. It is a level 6 standard and it's 36 months in duration plus the endpoint assessment time. And on completion of that endpoint assessment, apprentices are eligible to apply for UK PHR practitioner registration. Exactly how that works is still being established with the UK PHR board, but we've got some time before anyone goes through endpoint assessment to sort that out, and it's well underway. We have four cohorts underway already, with more to come in January, and I can see Margaret's on the course. She was the first one to kick off in Salford. the implementation of this is being led through regional employer forums, so we can connect you into those if you're not already. Finally, just very quickly, the Health and Care Intelligence Specialist at level 7. It's also a 36-month plus EPA. Again, it could be a progression route from the level 6 if you have a background in maths and statistics. But for this apprenticeship, you're taking data which can be individual or population level of health and use of services, and you turn that into evidence to inform decisions and influence decisions to improve population health. So this is also found across the whole breadth of the health and social care system, and within OHID, UXA, the NHS, and local authorities. We're expecting a cohort to begin next autumn, so September time, and you are eligible for registration with the Association of Professional Health Analysts as well. So I touched on progression routes. This is a draft diagram of progression routes through the public health apprenticeship standards, and other routes are definitely available across health and science and care, business and administration. But these are just some examples of a route through apprenticeship standards. We do really want to expand on this with input from employers as well, so this is just a start. I think this is the final slide for me. Just a couple of key points about these standards. They are generic standards, so if you complete a programme, you can be employed by any of the employing organisations. So the standard can be used by any sector, NHS, private, voluntary, local authorities are kind of alluded to. They were drafted by a group of employers and training providers called the Trailblazer Group, and they were written for a wide audience. So we've tried to pull out any specialised language in there, and it's future-proof. So there's not any reference to specific tools, models, acts or legislations. So this will be for the training providers to implement. Kirsty, it's on to you. So I've told you all about the public health apprenticeships, but what is an apprenticeship?
So thanks, Hannah, and hello again, everyone. So this is the kind of nuts and bolts of any apprenticeship. So we really wanted to kind of just give you the key points. 80% of the learning is on the job. So that's the fact that, you know, you've got somebody here who's an employee first, and they do study as part of that, as part of their job role. And the amount of study is 20% off the job. Now, I knew there was people in the Menti saying they'd like a bit more information about the 20% off the job, and we can talk about this a bit more afterwards as well. But just to give it a bit of time now, when it says off the job, you know, that can create connotations that it has no link to your job, or, you know, you must be outside of the office, or you must be in a different situation, which is not the case. So in some situations you might have quite a standard split of 80-20, where somebody is, say, in the office, wherever that is, 4 days a week, and then 1 day a week they are outside of their office and they're with their training provider and they're just doing their training in that situation. But then in a lot of situations, actually the 20% off the job involves quite a lot of being in the workplace, and that could involve shadowing, it could involve particular work meetings, as long as it can be evidenced in the portfolio as, you know, substantial learning, then, and there's lots of flexible and interesting ways that you can do that, then that doesn't necessarily mean that person is outside of the job. In our team in Talent for Care and HEE, we have quite a few apprentices at different levels, and most of the time, you know, we're all working virtually at the moment, and so what we have is most people are in work every day, but one of my colleagues on a Monday is on her study day, so she's around, and, you know, she's not fallen into a black hole anywhere, but we know that her priority that day is on her coursework and her study, but she might be coming into a meeting shadowing us to find out a bit more about how we influence up, or she might be coming along to find out about communicating out to stakeholders, which are all key parts of her apprenticeship. So so in real terms, it can look a lot more fluid and flexible than it might seem on paper. So I think that's just worth saying a bit about. It is hands-on experience and training plus vocational learning. So like the examples I've given of my colleagues who I work with in my team every week, It's very directly relevant to what you're doing. It is about doing that job, progressing through that job, and the study element being a real boost underneath it to enhance your skills and knowledge and behaviours in that role. It applies to all staff, so these can be people completely new to your organisation, new to your team, or a really effective way of developing people already within the team. And we see that across lots of different types of standards across health and social care. It'll be true of standards that are outside of health and social care as well, that sometimes the best people that you want for that role are with you. They just need that development, and an apprenticeship can be a really good way to do that. It's also a really good way for people to change career. So, and this might be very true of, for instance, the level 6, but it applies, you know, it will apply to all, that somebody can have been in a role for a long time. Maybe they're in the same or similar workplace, but they're not doing exactly this kind of role, or maybe they're from a completely different sector. As long as they haven't done significant learning in this topic before, they can be on the apprenticeship. So it really provides a lot of opportunities for people who might be looking for a new direction, or have always wanted to do something but weren't able to do it. Lots of really good opportunities for widening the pool of people that you're working with, for widening access and participation. So lots to consider in that space, really. Can be any age. I talk to a lot of employers every week, and to apprentices. I speak to people who are 16, I speak to people who are 67. There's really no caveat on that. So one of the kind of stereotypes of an apprentice, like we've got in that photo there of a young person working in an admin role, absolutely, there's a lot of apprentices doing things like that, but lots of apprentices look like all of us on this call today. So there's no one kind of size fits all, really. In terms of pay, and I appreciate it's going to be a bit difficult to talk about pay with so many different sectors and different types of employers, but we will try and give you some guidance on this. The legal threshold is the national minimum wage for apprenticeships. We're going to give you a bit more detail about that in a second. But certainly in the NHS and across health and social care, we're very keen to pay more than that. If you don't know the rate already, you'll see it in a subsequent slide, but we think there are really good advantages to paying significantly higher than this, and paying on a kind of training wage band. So that will look different in different employers, but we'll tell you a bit more about that in a second. Next slide, please. Thank you. So just to go over the fact that the training costs for apprenticeships are fully funded. This is through something called the Apprenticeship Levy, which you may or may not have heard about, but it's been around for a while now. It's across all sectors, and basically for employers who have a wage bill of 3 million or more, a proportion of their wages are used for apprenticeships. And there's lots of detail around the Apprenticeship Levy. And to be honest, it may not be relevant to become experts in the Apprenticeship Levy. You can leave that to us. It's a kind of technical area. We're more than happy to tell you all about it if you want to. But to be honest, the most important thing, if you're looking to be an employer, is that you can receive levy if you don't already pay it. So your organisation may pay the Apprenticeship Levy already. If you are not sure, then you can ask people in your HR team or in learning and development. But if you're a large employer, as mentioned there, £3 million or more turnover, then you will be paying it. If you're a small employer, then you probably won't be paying the Apprenticeship Levy, and then you can receive levy through what's called a transfer. Both of these routes cover 100% of the cost of the education and training in the apprenticeship. So that's just to say that it's fully covered. Next slide, please. So just to tell you a bit more about levy transfer. So within health and social care, you can talk to your training hub or contact the team that I work in around levy transfers. I've just noticed that I should have updated this slide, I'm afraid. This gives you an email address to go for the levy transfers. I would advise, you can still use that, absolutely, it's not closed or anything, but I would actually advise you go to your regional relationship manager, and the details for them are later on. But they are, as I said before, they're your kind of experts in the field. They know all about this, and they'll be able to know what's going on the ground. Some people want to have a levy transfer within their local area. So in health, that might be your STP or your ICS. Don't worry if you're not in health, you know, just think of it as a local area. But if that's not available or that's not what you're really after, then there's lots of other ways to receive transfers. We work with partners inside and outside of health. So we work with a lot of food and drink manufacturing companies, for instance. They're very interested in supporting health and care. I'm sure they'd be interested in supporting other, you know, sectors with development of public health roles. This is not something exclusive to public health. This goes across. So there's lots of opportunities for people to transfer money in. You'll find out a bit more detail in another slide. But the Education and Skills Funding Agency, which is basically the government body that looks after all apprenticeships, they also have a transfer service. So whether you're looking for transfer for yourself to receive it, or you're a big employer who'd like to support others and would like to pledge some to other people, then you can use that service as well. And as I said, your relationship manager will be able to give you the nuts and bolts of that. Next slide, please. So I don't know how well you can see this because the writing is a little bit small on the screen, but when you get the slides, hopefully you'll be able to zoom in if you can't already. But this just gives you an example of some Levy transfers that we facilitated this year, to just give you an idea of the kind of scale of the potential and things that are available to you. You'll see down there in the south, recently there was 150,000 transferred for nursing associate apprenticeships in primary care, right up to over 2 million. That was a strategic relationship between one of our food partners and the Yorkshire Ambulance Service. So there are lots of opportunities in this space, and this is just to say basically that, you know, the funding for the training should be no barrier to implementing apprenticeships. Lots and lots of things we can do around that. So if you have any concerns around that, we can absolutely help. Next slide, please. OK, so just to go back to pay, like I say, we've got different sectors on the call today, and there'll be different ways that it's implemented even within the same sector. But the national minimum wage for apprenticeships is £4.30 an hour, which I'm sure, you know, if you don't know already, may surprise people. It is a low wage, I would say, in my opinion. And that's why we advocate for paying much higher. I've been working in this sector for quite a while now, and I have seen that employers who do pay the right on the wage do experience turnover of staff. So there is a real value to paying more than that and retaining that staff, because there's a potential of losing them to other employers in the same sector who may be paying more. In health, we have a lot of people who are paying about 70% of the wage for the what we call banding in the NHS, or, you know, pay scales in other sectors, which kind of reflects the fact that somebody is working towards their full competency in that role, whilst recognising that they're a hardworking employee. There's more about this in the NHS terms and conditions of Agenda for Change. So if this is your sector, then please follow that link and find out about the kind of training scales and how you can implement that, and how the nuts and bolts of that could work in your employer. But as a kind of guide, I would just say that that's a good area in which to work, to remunerate, you know, hard work, whilst recognising that it's a kind of training post. OK, next slide, please. So just a bit of myth busting, because there's, you know, lots of myths out there, and apprenticeships have been around for a little while, but if you don't work in them, or you're not, you know, not like me and Hannah, lucky to be geeks on this every day, then there's stuff that you might not have come across. So, you know, there's a kind of image that apprenticeships can be for administrators. Obviously they can, and that is wonderful, but also apprenticeships, you know, involve really deep training across multiple levels, as Hannah mentioned at the start, right up to level 7. So, for instance, we are now in health developing an apprenticeship in medicine. So to be a doctor as an apprentice, you can be a physio, you can be an occupational therapist, you can be a midwife, you can be a whole range of roles. So it really goes right up from level 2 all the way up to level 7, and can provide lots of ways in and out and sideways across careers. So it's worth bearing that in mind when you're thinking about your whole workforce and planning where support would be helpful, because you've got the public health roles that Hannah mentioned before, but there may also be interconnecting roles that help in that space. It might be worth looking at not just the public health roles, but also kind of business management, other roles. There might be, in certain situations, clinical roles that interface with these. So worth considering the whole gamut of possibilities, really. I've spoken quite a bit about the apprenticeship levy, but a lot of people still think that you can't employ an apprentice if you don't pay the apprenticeship levy. That is not the case, and as I said, we can absolutely facilitate access to funding, so don't let that stand in your way. Kind of myth that kicks around is that apprenticeships are for people who aren't academic, and I would say, I mean, it's not true as a general, like, catch-all term. One of the great advantages of apprenticeships is they can be for people who aren't academic, and if, you know, school wasn't for you, or you know, your brain works in a slightly different way, then that's why apprenticeships can be really strong, because the focus is on being an employee and doing the day-to-day work, and less so on kind of full-time study, which might be more suited to people who do feel more academic. But there are rigorous kind of academic components to the degree level apprenticeships, the level 6, the level 7. You know, you're not going to get through them if you're not able to do the study element. So it's not that apprenticeships are an easy option, as it were. All qualifications that are tied to apprenticeships are in full parity to the non-apprenticeship route. So to give a kind of straightforward example, nurses who go to university as student nurses and then come out as registered nurses are exactly the same as nurses who train via an apprenticeship. The main difference is the time that it takes, because a registered degree in nurse apprenticeship is 4 years, student nursing is 2 years, but the qualification is exactly the same. So there is complete parity across these things. The apprenticeship is not a kind of diluted or watered down version. The qualification is exactly the same. Sometimes I hear people telling me that apprentices only exist in large employers, which is absolutely not the case. We support a lot of people in primary care, working in excuse me, GP surgeries, smaller employers, charities. There are real advantages to working in cooperation if you're in a small employer. So if you're coming to us today excuse me, from a small employer, then do talk to us and colleagues about getting into your systems, and finding those ways to work in collaboration with others, because that can bring a lot of advantages. I also hear that apprenticeships are only for young people and new recruits, which is something that existed. Excuse me. I really don't know what's happening, but I seem to be dying on this phone call. Apprenticeships only for young people and new recruits. Something from the old days of the apprenticeship agenda that doesn't really exist anymore. Hannah, I might have to give you the mic for a second.
Do you want to take over?
Yeah,
recover. So we're on the apprenticeships only for young people and or new recruits. So as we said before, you can build in apprenticeship roles into your organisation. So apprenticeships could be a new role, but they could also be used for existing staff to upskill them and to keep them interested in what they're doing, to develop them. So there is an apprenticeship contract, but you can convert an existing post onto an apprenticeship. And we can come back to that if I've not covered everything Kirsty would have said. And if you have a higher level qualification, you are ineligible for an apprenticeship. So that is also not true. So you could have a degree in something completely different to public health, but because the public health apprenticeship would be new learning, you are able to take another apprenticeship degree in public health. As an example. Kirsty, are you okay?
Thanks, Hannah. Yeah, I seem to have changed my throat. Sorry, everyone. I don't know what's going on. Thank you, and thank you for stepping in at the last minute. Yeah, so again, we can talk about more myths and busting that in the Q&A section, but hopefully that gives you a bit of an introduction to some of those things that persist. Next slide, please. So just a kind of thing to mention in case you don't know. So part of the apprenticeship agenda is around general upskilling, and lots of people who take apprenticeships are looking to improve their skills, not just in that topic area. And it's a requirement of the apprenticeship that apprentices who don't have the equivalent of a grade C or 4 at GCSE in maths and English gain it as part of their apprenticeship. So it's a really useful part of the apprenticeship agenda. It gives people an opportunity to get those skills that they maybe didn't get at school, or you know, haven't used for a long time. This particular portfolio, like English, maths and digital skills, is something that I lead on for Health Education England. So there's lots and lots that I could say if we were talking about this particularly today. If people are interested in this, then there's lots of things that you can do to find out more. We have a mailing list. We do lots of webinars and other things on this topic. So do let me know if you'd like to know about that. I would say that it's really part of the widening access agenda when it comes to apprenticeships. So but also maths and English, and particularly maths, holds a lot of anxiety for people, and sometimes just this set of skills can stop people progressing, either because they don't hold the qualifications or because people are so scared about their capability in this area that they don't put themselves forward. So it's a real consideration, I would say, in terms of your general workforce planning. If you're trying to open the doors and widen access, think about this set of skills, because people do hold themselves back because they think their maths is rubbish. And just on that point, there is a lot of evidence to say that interventions in this space are as much around psychology as they are around maths capability. So lots of people feel terrified of maths. Their math skills are actually okay, but they don't think that they are, and they don't like applying them, and they have bad memories of school and all the rest of it. So again, if you're looking to your general skill mix, apprenticeships can really help in that space, and there's lots of ways that the training provider will support the learning in that space, and there's other interventions that can help as well. Next slide, please. So a word on recruitment. Again, I'm sure we'll talk about this more in the Q&A, and you know, I'm coming from a health and care perspective, so there will be other perspectives from other sectors, but the training provider can really, you know, give a lot of support when it comes to recruitment. You know, it's in their interests for there to be lots of people on programme and to get good candidates. The best training providers will help you with advertising. They will help you with screening candidates. I know of training providers that will do all of that early recruitment first, and then you get given a kind of short list of good candidates. If you're recruiting externally, they can help with the interview process. They can help with all kinds of screening. So absolutely use them. Advertise locally. I know it sounds very, very obvious, but particularly in small employers, sometimes people will say to me, oh, you know, we're really looking for an apprentice, but we couldn't find anyone. And you'll ask how they were looking to recruit, and then they'll say, well, you know, we put an advert on our door, and it's like, well, there might be other ways that you need to do that, you know, and then there might be forums locally that would be helpful, online and offline. I would say, you know, don't forget about offline, because, you know, we're all very used to using digital platforms, but there's lots of other good stuff out there as well. And to use the existing systems. So again, that, you know, that applies to whether you're going internally or externally or both. Again, there's lots that we can say specifically, but that might, you know, the nuts and bolts of how to do that specifically might be best taken up with your regional colleagues and things like that. Next slide, please. So I've been talking about them a lot. These are your regional apprenticeship relationship managers in the NHS, working across health and social care. So you'll have their details. If you're in a local authority and, you know, health and care is not exactly relevant to you, then, you know, you might want to just get in contact with them and see if they have a kind of way of introducing you to other local networks or other local employers. So yeah, that was just my kind of heads up to everyone in our lovely team. Next slide, please. This is a flag for our website. So this is HASO, H-A-S-O. If you put that into Google, it's the first one that comes up. It stands for Healthcare Apprenticeship Standards Online. And it's a kind of library of information about all things apprenticeships in health and social care. This screenshot is taken from what's called our toolkit. And you can see it has all kinds of information about loads of the topics that we're trying to cover off today, and that hopefully will be of interest to you. from really broad, big picture things like organisational strategy, to the nuts and bolts of how, you know, you would procure a standard, or things like the costing calculator, which is a really useful way of putting in information around the standard that you'd like to use, the kind of pay grade that you'd like to use, and what the return on investment would be over a period of time. Can be really useful when making this case to senior management. You know, if you're trying to make a kind of workforce change, and those actual details and stuff around the money can be really helpful. You know, there's lots of stuff in there about the funding and all kinds of bits and bobs. So please do use that website. There is a newsletter that comes out on a Thursday, very digestible. It has kind of like 5 headlines for the week with top tips. So I would really recommend signing up for that as well. Next slide, please. So this is just, we wanted to say a bit of a point about our national procurement framework. So we work with Salisbury NHS Foundation Trust as a partner to us to manage the procurement side of things when it comes to apprenticeships in health. So what I mean by that is that we as a team will look at a standard. So for instance, we're just going through the process now for the Community Health and Wellbeing Worker Standard. Say to the training provider world, we want to put this on, and we want to have a kind of gold standard of what we consider really good provision and really good delivery. Providers will then apply to that framework and say, this is how we're going to deliver it, this is what we're going to do. We have certain quality marks, so that will be around the flexibility of the training, how much engagement with employers happens, kind of co-design, co-delivery, markers like that, and we will score based on what the training provider gives us, and then those that we think are of the top quality go on to our framework, and we advertise that to employers. So for that particular standard, we hope that the providers will be publicly available with a kind of support toolkit very soon. We do have a list of 6 at the moment, which will circulate round after, you know, with the other stuff after this event. But, you know, you don't have to use those ones. They, you know, you can use whichever training provider you want to, but these are the ones that have gone through our kind of quality mark, and we kind of stand by in that sense. So that's just a bit about the quality of the training providers. Right, okay, so it seems we've got to the end of our bits and bobs, Hannah. Now it's open to the floor. So we were saying that people can just put up their hand.